Hey everyone, how you doing? Today, let's look at veneers. What are veneers? Should you have them? What can they achieve? Everything you need to know about porcelain veneers. Now, when people look in the mirror and they don't like the appearance of their smile, it seems to me that the first thing they think is, let's get porcelain veneers. Everyone they follow on Instagram has got porcelain veneers, so this must be the best solution. Now, the truth is there are a whole bunch of cosmetic dental treatments available to help you improve the look of your smile, especially if you're young. Smiles can dramatically be improved just by straightening out the teeth, tidying up the bottom edges, maybe with some composite bonding, and whitening to boost the color. Not only is this less expensive than porcelain veneers, but also there's much less upkeep going forward. Now, this video is about porcelain veneers, so let's get back on topic. Okay, so Anna, if somebody calls up and asks what a veneer is, what do we tell them?
So sometimes it can be described as like a false nail. So it's a material going over the surface of the nail, but obviously on the tip.
Cool. Okay. So what if you're like me, you have no experience of a false nail, you kind of turn off whenever your wife's talking about false nails. What is a veneer? A porcelain veneer is essentially just a covering on the front of the tooth. And as the name suggests, it's made of porcelain. There are other types of veneers. You can have veneers made out of composite material. These are typically less aesthetic and less long-lasting. Now, a veneer can change the color of a tooth. It can change the overall look. We can change the height-width ratios and pretty much change the whole look of a tooth. But one veneer on its own for this purpose is usually of no use. What we want to do is create a new look to the whole smile. So this means you have to have multiple veneers, and the number which is appropriate to you is going to vary. So again, get different opinions from different clinicians. Some people will immediately say, yes, you need 10 or 20 veneers, just do everything to get the look you're after. But realistically, a dramatic improvement can be achieved with as little as 2 veneers, depending on the extent of the problem which you have. Now, a lot of people go abroad to have veneer treatment because it's so expensive in the UK and in the US, I understand. But the important thing to realize is you're typically not getting veneer treatment when you go abroad. Let's look at some models and I can explain this in a little bit more detail. So these are models of a lady who went to Turkey, had veneer treatment done, and she had a bit of a disaster. So we're redoing it. And on this model, we can see the look of her teeth once we took all her old crowns, bridges, everything off. And you can see there's very little tooth left on the front 4 teeth. This means the teeth have been heavily prepped. By prepping, I mean tooth reduction. Someone's taken a drill and literally ground the thing to pieces. Now, we did veneers all the way up to tooth number 5, and tooth number 5 didn't have any veneers on it previously. I needed to do almost 0 tooth preparation in order to have a veneer placed on tooth number 5 here. If you're wondering, we count the teeth from the middle outwards. Now, the reason that the amount of tooth preparation is important is that inside each tooth there is a nerve. And the closer you get to the nerve, the more chances are that we're going to have problems. Okay, if you get close to that nerve, it's going to flare up. You could possibly need root canal treatment, or even worse, have a tooth extraction. All because a tooth has been what we call over-prepped. Now, problems with veneers are much less common if the tooth is minimally prepared, okay? And that's why you'll see loads of dentists, especially in the UK, going on about how little preparation they did to the teeth in order to get the kind of look that they achieve. Now, if you go abroad, typically they're not going to care so much about this kind of stuff. This lady had most of her front teeth root treated after having too much preparation done abroad. So the goal of veneer treatment is actually to create a beautiful looking smile, to improve the confidence of our patients without a big, what we call a biological cost, without a deterioration in health. Okay, we're not going to compromise aesthetics for health. We want to have everything. Now, the way we do this at our clinic, and we are a little bit different, is the first thing is we plan the smile. We talk with our patients, we decide how many teeth we're going to do, what we like the look of, what we want to improve. And this really gives us a deep down understanding of what we are trying to achieve, and hence the number of veneers which are going to be needed in order to achieve that goal. We look at things like the height-width ratio of the teeth, the color of the teeth, the width of each tooth compared to the tooth next door. Nobody wants to have a smile that looks like a piano. So the first thing we want to look at is the smile line. This is when we draw a line that connects the bottom edge of all the top teeth. And we want this to be parallel and a little bit shorter than the smile or the line of the lower lip. And this is one of the most important lines to get right. So sometimes we see people who've got their front teeth and they're shorter than the back teeth. This creates a reverse smile line, and this doesn't look that great. So this is something we need to improve the look of. The next thing is the midline. Okay, we want the midline of the front two teeth to be parallel with the middle of the face. I don't actually mind if it's off left to right a little bit, but it definitely cannot be slanted like that. That's really obvious, and that's something we need to address early on. Another factor of smile design, which is really important, is the width of the tooth. We want each tooth to gradually get smaller as we look at it from the front. So for the geeks among us, there is a ratio that dictates how much smaller each tooth should be, and this is the golden proportion. It's 1 to 1.6 all the way across. Okay, so the front tooth is 1.6 times bigger than the tooth next door. Now, there's a whole bunch of other little factors which we take into account, like the angulation of the teeth, the amount of curvature on the front and back edge of each tooth, but this video could get very boring if I discussed all of these with you. So once we've got a plan and we know what we want to achieve, what we do is we create that smile in our patient's mouth and we let them go home with it. So the whole point of creating the smile in temporary materials is that the patient gets a chance to visually preview what the end result is going to look like. And they can go home, let the anesthetic wear off, okay, the smile becomes normal, they can have a drink without spilling it all down their shirt, and they can ask their significant other what everybody thinks, okay? We can make changes to the temporary smile, okay? That's really, really important in this whole process, because we don't want any surprises. It's like going to McDonald's, choosing what you want, you see a picture of this amazing looking burger, and what you get is actually pretty accurate, okay? They've done well. It never used to be the case. It used to be that you get something horrible and it was a massive disappointment, okay? It's the same thing with veneers. You don't want to wait until the fit appointment to know if you're going to like the look of your veneers, because really by that stage, it's way too late. Now, once we're happy with the look of the veneers and we're happy with the bite and nothing's breaking, then we can take a digital scan or an impression of the veneers, of the temporaries which we've created. We then send this to the lab and the lab will copy the veneers. Now, the lab we choose is really, really important because hardly anybody does their veneers in the way that I've described. Most labs are used to just freehand making up the veneers. Now, some of the ceramists might think that they are the Leonardo da Vinci of porcelain veneers, and they can do a much better job than the temporaries which we've provided. And they probably can, but remember, our temporaries have been approved by our patients. This is what they're expecting. So we have to actually work very hard with certain labs, and I found one lab that is really, really good at copying my temporaries. They're really annoying to work with sometimes, but they are really, really good. So we know that when we get the veneers back and we try them in side by side, so temporaries on one side, veneers on the other side, there's not going to be a big difference, and we've copied a lot of the information, and it's a really, really good copy actually of the porcelain veneers. So this means our patients are happy. This means our patients' partners, significant others are happy, and that's what really matters. Now, there is a dark side to any kind of treatment, okay, whether it be cosmetic or health-based, dental or medical. Everything has a level of risk. Now, with veneers, there is risk. Veneers can break, they can chip, but that's not really that big a problem. The bigger problem is if the tooth is prepared far too much, and that can potentially lead to root canal treatment and further treatment. This is inevitably going to shorten the lifespan of your natural teeth. And I've done thousands of veneers. Even when you're being super careful, these things can happen. I'm guessing maybe we get one tooth every year or every couple of years that needs root canal treatment as a result of the treatment which we provided. Now, typically these teeth are already heavily filled, they've got underlying issues, but it can happen when almost nothing has been done to the tooth. It's really unfortunate, but it is a risk that we need to be aware of. Now, getting the teeth to look good with veneers is actually quite easy. It's getting the gums and the aesthetic difference and the contrast difference between the pink of the gums and the white of the teeth. That's what can create a dramatically amazing looking smile. If you want to find out more about how we can change the gum, check out my other video where I talk about this in much more detail, and I think it's probably the most popular video on my YouTube channel.